Thousands of Americans die from strokes each year. Neurologist Dr. Lee Voulters with Memorial Health joins us now with more on what you need to know about strokes that could save your life. First of all, there are different types of strokes that people should be on the lookout for, right?
There are indeed. The commonest type is what we call ischemic, where there's a decreased blood flow to the brain from a clot or a blockage, and that causes damage to the nerve. That's the commonest type. 85% of strokes are that. Then another 50% of what we call hemorrhagic strokes. There's bleeds. Bleeds can be from high blood pressure, they can be from ruptured aneurysms and things like that.
So we know that sometimes strokes can be fatal very quickly, but what are some warning signs that it might be escalating to look out for?
Yeah, well, there's a number of public educational programs, and one of the best is Be Fast, which is an acronym. So that tells the public what signs to look out for. Be Fast. B is for balance, so problems with balance. E is eyes, so vision problems, double vision or loss of vision in one eye. F, which is face, so facial drooping. A is arms and legs, so weakness on one side of the body, arm and leg. S is speech, so any speech difficulty, not being able to speak or not being able to understand. And then T is time, which is probably the most important. That is, as soon as you have a concern about a loved one or someone you know having a stroke, call 911 and get them to the hospital immediately.
That is immediately, and there is Be Fast. You saw that outline there of those talking points. And well, time is of the essence. When you maybe see one, I know every case is different, but when you see one of these warning signs, how long can it take to get medical treatment? Or you said get your medical treatment immediately. What kind of medical treatment are we talking about?
We're talking about for the ischemic strokes, which is the commonest type of stroke that we see, 85%. We need the two major things which are time dependent are, one is getting them what we call a clot buster drug, and we have about 4.5 hours from the time of onset to get a good result, but the quicker the better. And then the other, and that means we inject a blood thinner, where it's a blood clot dissolver into the bloodstream, which will dissolve the clot of blood, and that works very well. Even better than that, in certain types of stroke where there's a big blockage in one of the blood vessels in the brain, we can go up with a catheter and take the clot out. But we have a few hours to do that. But again, the quicker the better. And then we have great results. We can have people who are devastated with the strokes. If we give them these life-saving measures, we can virtually reverse their problem.
Those are great treatments. And all right, so those were the treatments and the signs to look out for. What are prevention? Earlier in life, what can you do to avoid strokes later?
Well, very important. You know, prevention, of course, is primary. So high blood pressure is probably the #1 risk factor. So if you have high blood pressure, you've got to get it treated. You've got to take your medicine on a regular basis. Diabetes, again, you've got to go and see your doctors on a regular basis and have your blood sugars controlled. Smoking is a big factor, so don't smoke. I mean, there's lots of problems health-wise with smoking, but certainly stroke is one of the big ones, as with heart attacks. You know, obesity, being overweight, again, is a big risk factor. So healthy diets, exercise, all these things will prevent you having strokes.
And so many other things.
And so many other things.
Yeah, well, those are good points we all need to recognize there about strokes. Doctor, thanks so much for coming in for us
today. It's my pleasure.
Thank
Thank you for having me.